Hello everyone, this is Mohamed Yusuf, and thank you for joining my presentation today. Today I will present about Toxoplasma and toxoplasmosis, their prevalence, and also their risk factors. Commonly, Toxoplasma is a parasite that is potentially harmful to pregnant women and their also fetus. Throughout this presentation, I will cover these outlines, including the background of the study, statement of the problem, research objectives, methodology of our research, and also recommendations of our research. So, without further delay, let's start our presentation. We need to define what is Toxoplasma gondii. So we can define that it is an obligate intercellular coccidian protozoan parasite that causes a disease called toxoplasmosis. So this infection can infect everyone, but significant disease is commonly observed in individuals with weakened immune system, pregnant women, and also infected newborn child. This infection is mainly acquired through consumption of food or water that is contaminated. The cyst is shed by the cat or by eating undercooked meat containing the tissue cystis, especially pork and lamb. So we need to keep in our mind that this infection is zoonotic. Also, the infection or this infection can also occur or can also transmit via mother to fetus, or what we call it vertical transmission. And this stage is called this stage. It affects and our cause is what we call congenital toxoplasmosis. In this case, it will affect the brain and the brain function. Globally, the prevalence of Toxoplasma gondii infection among pregnant women ranges from less than 1% to more than 85%, depending on the geographical locations. For example, studies reported in the Sero Prevalence of Toxoplasma gondii among pregnant women was 41.8% in India, 41% in Iran, and also 49% in Malaysia. These variations of prevalence are associated with different factors, such as dietary habit in terms of method in cooked meat, kinds of meat or vegetables consumed, hand washing techniques, etc. In Somalia, there is no known or there's no data about the prevalence of this infection since the central government collapsed in 1991, and also including Health Care Organization. For this reason, there isn't full information about the prevalence of toxoplasmosis in the country, but it is estimated before the civil war that it was 43.6% in Lower Shabelle, while 40% in Mogadishu, according to Hinda and her team of researchers in the year of 1988. If we come to the statement of the problem, toxoplasmosis during pregnancy is as we know, is a great public health concern due to its capacity for development of potentially health risk to fetus of pregnant women who acquired the infection during pregnancy, which may cause congenital toxoplasmosis and also other problems such as abortion, premature birth, and also intrauterine growth retardation, which may lastly cause congenital toxoplasmosis. And also in Somalia, serologically screening of pregnant women for this infection, especially the antibodies of this infection, is not routinely carried out, which is really unfortunate. Besides this, there are many risk factors of acquiring this infection, such as poor living condition, low public health awareness, poor water sanitation, and also poor hygienic practices for food preparation. So this gap highlights the researchers and motivated to determine the Sero Prevalence of Toxoplasma gondii and associate the risk factors among pregnant women seeking antenatal care at source hospital. Coming to our research objectives, the general objective of this study was to determine the Sero Prevalence of Toxoplasma gondii infection and associated risk factors among pregnant women seeking antenatal care at our study area. The specific objective of this study was to determine the Sero Prevalence of Toxoplasma gondii infection among pregnant women seeking antenatal care at our study area. The second specific objective was to identify the risk factors of this infection that is associated with our study group and our study area. And also the last specific objective was to determine which trimester of pregnancy of these seropositives of Toxoplasma gondii infection among pregnant women seeking antenatal care at our study area. We use, coming to our methodology, we use a descriptive cross-sectional study at Source Hospital, Mogadishu, Somalia, from November 2021 to May 2022. Also, as we use a structural questionnaire and 3 milliliters of venous blood. And also the data was collected and analyzed by using SPSS. Coming to our research findings, 57% of our participants aged between 18 to 25, 77% of our participants had no formal education. 66% of our participants were in the third trimester of the pregnancy, while here where it gets interesting, 94% of our participants never heard of and does not have knowledge about routes of transmission of Toxoplasma gondii infection. And 19% of the participants were seropositives of this infection. 42% of the seropositives were in the third trimester of the pregnancy, while 6% of the seropositive were IgM positive. IgM is a type of antibody specific to this infection, while 13% of the seropositives were also IgG or immunoglobulin gamma positives, which is also an antibody specific to this infection. Regarding our research findings and our research results, we recommend as researchers the following recommendations. The first recommendation of our study is screening of pregnant women of toxoplasmosis during antenatal care to prevent the complications of this infection. Also, we recommend the healthy education campaign towards this infection to minimize the risk factors among pregnant women, and also to prevent the complications of this infection. And lastly, we recommend a further study with a large number size to support the result which was obtained in our study. Thank you, everyone, and thank you again for joining my presentation today. And here is the end of our presentations. Any questions or any comments are highly welcome. Thank you.